So I think we'll go ahead and get started. Can everybody hear me? Larry, can you hear me? Is that on my side or?
Yeah, I can hear you pretty well
Okay.
over my speakers, but maybe say it louder.
Okay. Can everybody hear me? Yes, Melanie's shaking her head. Okay. Okay, great. So I'm Lindsay. I'm with the Human Resources Department. I'm working with Bruce for benefits for 2022. And today we have Larry Cade. He's with PEBB, so he's going to be going over the two options for insurance that we're offering this year. So without further ado, I'm going to go ahead and hand it over to Larry.
Hear me okay?
Yeah, we can hear you.
Okay, great. And I'm just going to share my screen here and show you some documents that I sent over earlier. Are you able to see that?
Yeah.
Okay. So your employer is offering two plans this year for the medical part of it. And what I do is I show you how to contact the plan. So if you have questions about your benefits, if you have questions about ID cards, claims, checking in the provider as part of the plan network, choosing a healthcare provider, or making sure prescriptions are covered, you want to make sure you call the plan directly. So what I did was provide you with the plan, be Uniform Medical Plan Select or CDHP, Consumer Directed Health Plan, are your two choices. Here's the contact information for the medical services, an internet address, and also the phone number for you. If you have questions about your prescription drugs, here's a web address and a phone number for you. I'm also going to show you where that's out here in a minute for you. Also part of your benefits is an auto home policy through Liberty Mutual that you could get a discounted rate for your auto and home policy. Here's their contact information, which we'll also cover in a little bit for you. And if you belong to the one, if you want to sign up for the one that says CDHP, Consumer Directed Health Plan, you'll be assigned a health savings account, and Health Equity is the vendor that for your health savings account. And then also we're going to have a voluntary wellness program through Smart Health, where if you earn 2,000 points by November 30th of next year, the following year you'll get $125 off the deductible the following year. So here's your contact information for that. Then I wanted to show you the dependents are eligible for your PEBB benefits. You can insure your legal spouse, your state registered domestic partner, and your children up to the age of 26. We also allow you to insure what we call extended dependents. So if you want to insure a grandchild, a niece, a nephew, just a child that you have court documentation showing financial responsibility for, you can also cover those under your PEBB program. You just got to get them approved before you join. So if that does happen, just let me know and we'll get the paperwork sent out for you so you can insure those children. Then also children with disabilities. So if you have a child who's over the age of 26, who was disabled before the age of 26, as long as they're approved by healthcare authority, they can be covered on your PEBB program indefinitely. So those are your eligible dependents. And if you are adding dependents as spouses, you have to verify those dependents one time. So if you're going to insure a spouse on your PEBB benefits, the two things you can use for verifying your spouse, number one is your tax return. The last year, first page only, blacking out all the financial information, as long as you list your dependents and your spouse on there, you can use that to verify your entire family. If you don't want to use your tax return, you can use a marriage certificate and proof of common residency, like a shared utility bill, bank statement, can be used to verify your spouse. So either the tax return or the marriage certificate with proof of common residency. For your children, you can use a latest year of the tax return. Again, first page only, blacking out the financial information. Or the birth certificate. If you don't claim your child on your tax return, you can use a birth certificate to provide definitive verification for your children. Now, through PEBB, we call surcharges. We have 2 of those. So this is basically if you attest to these surcharges, then you will be assessed a certain fee per month. So the first one is going to be tobacco. So we have a tobacco use premium surcharge. So if you test using tobacco products, this kind of lists on what products are. And here's a list of what tobacco products are not. But on your enrollment form, if you attest to using tobacco products, there will be a $25 a month surcharge on top of your monthly premiums. Then we also have what we call a spouse surcharge. It's not because you're enrolling a spouse into your PEBB benefits. It's if you're enrolling a spouse and they are employed, and their employer offers them insurance coverage, they decide to waive out of their coverage to be on your coverage and it's comparable to ours, then there will be a $50 a month surcharge. But if your spouse is not employed, your spouse employer does not offer benefits, if your spouse is on Medicare, you just basically check no to box 2 and you will not pay the surcharge. Does anybody have any questions about that at all? Okay. So again, what you want to do is basically answer these questions. Anytime you do no to any of these, just remember I checked no to box 2, for example, and this is what you're going to put on your enrollment form. Also, too, if the spouse's coverage is more than $114.01 per month, then you just check no to that, then you won't pay the surcharge either. So it really depends on how much your spouse's coverage costs through their employer. The next document I wanted to share with you is just a basic overview of the coverage. So your employer, I'm going to skip this page here, but your employer is offering 2 plans. One is the Uniform Medical Plan Select and the Uniform Medical Plan Consumer Directed Health Plan. These plans are essentially the same. The only difference is the Select plan has a $750 deductible and the Consumer Directed Health Plan has a $1,400 deductible. Now, with this one that says CDHP only, you'll be assigned a health savings account. There will be some employer contributions only from us, but also from your employer also. So for your high deductible plan, the one again that says Consumer Directed Health Plan, you have these employer contributions. I believe you have your own contributions. Have you shared that with them already? Okay.
Yeah.
And then we're also going to contribute more to that too. So basically for our part of it, we're going to put in $58.34 per month in that health savings account for a total of $700 per year. And then also $116.67 per month if you insure one or more dependents with you. One thing I do want to say about this plan is that you want to make sure that you're eligible for that plan first before signing up. One of the things that would make you ineligible for that plan is if you enroll in Medicare Parts A or B or Apple Health, you're ineligible for that high deductible plan. If you're enrolled in another plan that's non-high deductible, you're also making yourself ineligible for that high deductible plan. If you or your spouse is enrolled in a VEBA plan that's not limited purpose, we mean by limited purpose used for vision and dental only, you are eligible to enroll in that high deductible plan. If you're enrolled in TRICARE, you're ineligible for that high deductible plan. And also too, if you're enrolled in medical flexible spending arrangement, the FSA, that's not limited purpose, you are also ineligible for that high deductible plan. And also too, if your claim is a dependent on someone else's tax return. So these are kind of the things that kind of make you ineligible. Nobody's going to tell you you can't do it. It's up to you to find out whether you are or you're not. My suggestion to you is maybe talking to a tax advisor or health equity to help you determine whether you're eligible for that high deductible plan before signing up. So going back to the medical benefits comparison, this here is just a general outlook of all of them. Okay, I'm going to show you where the certificate of coverages are at. So if you wanted the detailed information about the plans, you want to go to that certificate of coverage. This is kind of a general overview of the plans. So the two plans we're looking at is Uniform Medical Plan Select and CDHP, Consumer Directed Health Plan. We're going to have medical plan. Here's a deductible for you, $700 per person, $22.50 per family for Select. That means before the plan begins to pay their portion of the bill, you have to meet this annual deductible first. For the high deductible plan, it's $1,400 or $2,800 per family. So you have to meet this deductible first before the plan begins to pay their percentage of the bill. Then you have the medical out-of-pocket limit. This is the most you're going to pay annually for your benefits until the plan begins to pay 100% of the bill. So for example, the Select for a person, you have $3,500. So once you reach $3,500 for medical services, then the plan pays 100%. If you have a family you're insuring, it's $7,000 per family. So once your family reaches $7,000, then the plan pays 100% for the rest of the year. And for the high deductible plan, Consumer Directed Health Plan, $4,200 per person or $8,400 per family. As far as prescription drugs is concerned, the Select plan has a prescription drug deductible. It's $250 per person or $750 per family. And we're going to go over that in a second for you, but it's for tier 2 prescriptions above. That's basically brand name. If you take in generics, then there will be no annual deductible. And prescriptions also have an out-of-pocket limit for the year. It is $2,000 per person or $4,000 per family. Once your prescriptions reaches $2,000 for a single enrolled person, then the plan pays 100% after that. Same with the family, which reach $4,000, then the plan pays 100% after that. And for the high deductible plan, it's included in here medical out-of-pocket max for the prescription also, because those two are combined. They offer emergency services. They got ambulance and emergency room. These are PEBB and co-insurances for that. Also included in your benefit is going to be hearing services. Got hearing aids, one hearing aid per ear every 5 years at no cost to you. Then also one annual hearing exam at no cost to you for the Select and 15% for the high deductible plan. And skipping to the next page here, again, Select and the CDHP plan. You got the outpatient for hospital care, inpatient for hospital care. These are co-insurances for that. And then we have office visits. For this plan here, that you can go to the doctor. You won't pay your copay or co-insurance up front. You will be billed for your copay and co-insurance after the visit. So depending on which plan it is, it's 20% for the Select. You're responsible for the part of the bill. And for the high deductible plan, it's 15%. You're responsible for the bill. They include therapies, acupuncture, chiropractic, massage therapy, all included in the benefit. You see for Select there, $15 copay, 24 visits for each of those therapies. And along the same thing after deductibles are met for the high deductible plan. And for physical occupational speech therapies, you can see 60 combined visits per year. Your co-insurance is 20%. And for the high deductible plan, it's 15% co-insurance, but 60 combined visits a year for all of those therapies. And vision is included in your medical plan. Are you going to have a separate vision policy, or are you going to just have ours by itself?
We do have a separate one that we're offering, but
Okay.
it kind of along the same lines what the medical plan is.
Right. So again, you're going to have two of them. So you're going to have one through your medical plan if you sign up for it, and then you have your own, what you have through your employer. But this one here is $150 towards hardware every 2 years, frames and lenses, and one annual eye exam per year at no cost to you. So again, in order to have our vision, you have to be enrolled into the medical plan. And then prescriptions are included in the benefit also. You'll see here they have 3 different tiers of prescriptions. They have the value tier, which is kind of a generally commonly used generic prescription drugs. We have tier 1, which is generic. And then tier 2, we call brand name prescription drugs. And you're going to see here, depending on which level it is or which tier it's under, for the value, it's 5% responsibility. For tier 1 generic, it's 10% responsibility. And then tier 2, which the deductible will be in effect for tier 2, 30% responsibility after your deductible is met. Also, too, the prescription drugs, you can get a 90-day supply through the retail pharmacy, as long as a prescription can be written for 90 days. You do not have to utilize the mail order for that. So that's about the kind of a general overview of the medical part. Does anybody have any questions?
So in the old plan, at First Doctor, I had a $35 copay. Everything, for the most part, everything was covered. This new plan, I'm gonna, the whole doctor's visit, I'm gonna bill 20% of that. And then,
Were you able to hear that, Larry?
I'm sorry. I didn't hear it.
No.
what's 20% comes for insurance? That's 20% of the whole bill?
So
Before we were paying $35?
So can you just explain for a doctor's visit the 20 in more detail the 20% copay with coinsurance?
All right, so I just use myself as an example, okay? I have the classic plan, so I'm using myself for that. So after my deductible is met, and as long as you stay in a network of Blue Cross Blue Shield, they have a contracted rate. And you're responsible for 15% of that contracted rate. My 15% over the course of the last 5 years has averaged between $18 and $22 a visit. So you're getting billed after the fact, though. Okay, so you're going to go to the doctor, they're just going to send you a bill and going to bill you 15% of the bill. So it's not 15% of 15,000 or anything like that. It's 15% of the contracted rate. And my 15% has been about between $18 and $22 a visit over the last 5 years. Did that help answer your question?
For that plan, yeah. For that
I'm looking at the uniform medical plan. That's not the, this column here is the regular one, right?
Yeah.
Can you go over to the part about the spouse contract? You mean like for the spouse surcharge? Yeah.
Larry, can you just review the spouse surcharge again?
Sure. And probably the easiest way to do is tell me you're insuring your spouse and I'll ask you the questions. Okay. So who's insuring a spouse on their account?
Yeah, so we have one person in the room here who's insuring.
Okay. Is her spouse employed?
No.
So all she's doing here is clicking box 2 and marking in the form and she's done. She will not pay the surcharge.
So she was asking for some of her coworkers. So if they have a spouse who is offered medical insurance through their employer, and their spouse decides to keep that insurance, can our employee insure just their children on the plan if their spouse decides to keep their coverage?
Absolutely.
So yeah, she was just asking, I guess, so more detail about the surcharge. So if that spouse decided to waive their medical coverage, I know you mentioned it's only if the plans are comparable, but if you could just explain that a little bit more.
So basically what they want to do is answer these questions first, right? Go through and answer 2 through 6. If they're yes to all of these, right? The number 6 is, how much is it costing for that insurance coverage for the spouse per month on their health plan. If it's less than 114, you put yes, but if it's more than 114, you put no, and you would stop there. If you're saying yes to all of these, we have what we call a spouse plan calculator, cell spreadsheet. You would just go in there and enter 7 questions like deductibles, copays, and coinsurance, and it'll automatically tell you whether that person's coverage is comparable or not. And I think I sent that to you, but if not, I will definitely send it to you.
Yeah, I think you did. So anything that he's
Okay.
showing, we have, so we can send out to employees. Yeah, it's I have it as well, but it's also on a website, so we'll send out some more information about everything that he's showing today.
Was there other questions?
Sure. So for the prescription, is that normally when you go in there, you pay $35? Okay. Is that going to be a percentage of what it is now, or is it flat?
Yeah, so Larry, can you go over the prescriptions once more? So I think before it was just like it would just be up to $10, but just explain in detail the percentage of the amounts.
Right. And so the thing to do is I'm going to show you here in a second. You can do a prescription price check for all both these plans, right? This is basically the contracted rate of the plan, just like the medical services part, like when I go to office visit. For the value tier, you're responsible for 5% of the bill, but the max payment you'll be is $10. For the tier 1 generic, you're responsible for 10% of the bill. The max you'll be charged is $25. And for your brand name, you're responsible for 30% of the bill, but your max payout would be $75. Tier 2, there is an annual deductible, but not for the value tier and not for tier 1. And what I'm going to show you here in a bit after this little presentation here is I'm going to show you the website where you can do a prescription price check. All you do is type a prescription in. It'll tell you exactly what your percentage is before you even join. You don't have to be a member. Does that help? It does?
Yes, sorry, yeah.
Okay. So yes, as soon as I get done with this, I'll show you exactly where it's at. I'll show you how to do providers. I'll show you how to do certificate coverages, and I'll also show you how to look at your prescriptions too.
Okay, sounds good.
And then I also wanted to show you the Liberty Mutual part of it. So if you're part of Liberty Mutual now, all you have to do is give them a client number of 8246 and let them know you're part of PEBB effective January 1st. And let them give you at least a 12% discount on your auto policy and a 5% discount on your your home policy. If you're interested in a quote, just give them that client number, give this number a call, and they'll have you give you a quote for that. And here's a look too at the enrollment form in order to enroll yourself in the coverage. This first page here is the subscriber information, all your demographic information here. And then page 2 is just cover. Now, do you want people to fill a form out if they're waiving coverage? We don't need it, but do you want to have them still fill it out?
Yeah.
Okay. So we want to fill out section 1 and let us know whether you're waiving or covering. And then if you are covering yourself under medical, you have to attest to tobacco surcharge. Again, this is up to you to tell us what you want to put here. But if you do mark yes, there will be a $25 a month surcharge on top of your monthly premium. This next section deals with your spouse. So if you're adding a spouse to your account, we're going to need the date of marriage, or if you have a domestic partner, state registered domestic partner, date registered. Then you're going to complete the demographic information for the spouse. And then whether you're covering them on it or not. But if you're not covering a spouse, you don't have to complete this section. It's only if you're covering a spouse. But if you are covering a spouse, just click yes here for cover. And now you have to attest to tobacco use for them, yes or no. Remember those questions that we were talking about? Remember these questions here? So once you mark no, somebody said no here, you would just take it over here to the form. You would just do no here and question 2. That's it. And then you will not pay the surcharge. So if you mark no to any of those questions, you just do no and mark to any of those questions you want. And if you say yes to all those and you want to use a spouse online calculator, do a sales spreadsheet, you need to know your deductibles, copays, and coinsurances for your spouse's coverage, and it'll tell you whether it's comparable at. And if you need help with something, just let me know. We can go through whatever you want for that. And then section 3 deals with the medical plan selection. So your 2 selections are either UMP Select or UMP Consumer Directed Health Plan. Those are your 2 choices. Section 4, you can skip. You do not have to fill out section 4 at all. So I'm going to go right past that. And then section 5 is basically signing and date. It could be an electronic signature. It doesn't have to be handwritten. And then we have this section here. Put the employer's name there. You guys have this information available? Do you want me to supply that for you, or?
No, I believe we have that.
Okay, so you just want to make sure you put this here, and then also January 1st, 2022, January 1st, 2022 here.
Okay.
And then section 7, just dependents. I mean, if you're insuring dependents on your medical, you want to use section 7 to insure your dependents. Just let them know the relationship to the subscriber is, demographic information, and then cover for coverage. If you're not adding children, you do not have to fill this section out at all. And if they're over the age of 13, you want to attest to their tobacco use. Yes or no? And that's basically about it about the enrollment form. Any questions on the enrollment form?
No, I don't think so. They can contact us directly, and then if we have any questions, we'll let you know. And then just to confirm, they'll be sending these I have the forms that we can send out through email, so if they want to print them off and bring them into us, or they can send it just back to us directly.
Correct. And so I wanted to show you the website. And so what you want to do is just type hca.wa.gov in the search there. This is going to bring you to the Healthcare Authority's website. Once this comes up here, you're going to click in the middle section here where it says Employee and Retiree Benefits. All right, a couple different sections here. So if you're interested in retiree information, and for ours is if you're at least age 55 with 20 years of service or 65 with 5 years of service, you are eligible for our retiree coverage. So if you know somebody in that situation, let us know so we can talk over this part about it here once you separate service. But for your section here, you're really in public employees. Just click on that. The first thing I want to show you how to find a provider for the Uniform Select and Uniform Consumer Directed Health Plan. Once you're in that section here under public employees, you do find a provider right here. Once you're on that web page, you want to scroll down towards the bottom of the page. You'll see Uniform Medical Plan, Uniform Select, Uniform Consumer Directed Health Plan. Those are your provider searches there. They're going to essentially have the same provider network. Again, the only difference between these two plans here is deductibles and copays and coinsurance. That's it. So I wanted to show you also too where to find a certificate of coverage is at. So you want to go up here where it says medical plans and benefits, benefits and coverage by plan. Once you get on that page there, you want to scroll down towards the bottom of the page. And you're going to see here, Uniform Medical Plan, Plan Document, Certificate of Coverage. You have the one for Select and the one for Consumer Directed Health Plan. This is where you want to get detailed information about the plan. Everything from A to Z will be in that certificate of coverage. And the other thing I wanted to show you is where about the prescription part of it. So once you're here on the medical plans and benefits, you type on here, you click on the Uniform Medical Plan administered by Regions Blue Shield and Washington RX Services for the prescription part of it. It'll bring you to the Uniform Medical Plan page here. Then once you're here, what you want to do is go to the bottom of the page, and you're going to see here, visit the Uniform Plan website. Once it comes here, it'll bring you to the Uniform Medical Plan website. There's a lot of different things in here, but the most important thing I wanted to show you was the prescription part of it. So once you're on the page, you want to scroll down to the bottom there. There's all good type of information here for you. But you'll see the one for prescription drugs. So everything I do with prescription drugs will be on this page for you. And once that comes up, it'll show you everything prescription drugs for Uniform Medical Plan. You got preferred drug tiers by clicking on this here. Also, I promised you to find the prescription drug price check tools right here. So you either select or the CDHP plan. Just type your prescription there. It'll tell you how much it costs and what tier it falls under. Also, if you want to know what network pharmacy you can see, just click on this. If you're interested in mail order drugs, it's here for you for our Washington RX Services. So all information to do as far as prescriptions is on this page for you. Was there something else I could show you as far as the employee website?
No, I think we're okay for now.
Is there anything else you want me to show you? I mean, that's basically all I have for you.
Let me just check to see anything covered or no, I think we're okay for now. We are recording, just to let everybody else know, we are recording this meeting, so we can send out a link so anyone who wasn't able to participate today can rewatch it, or anyone who was here today can rewatch it at their convenience. But you know, any questions for anybody who's in the meeting, you can give HR a call, stop in, or email anybody in HR. And then if we can't answer the question, Larry will contact you and see what we need.
Absolutely. Absolutely.
Okay. And we'll be sending out an email as well with the employment, the application for benefits out to all of our employees. And then just a follow-up email with everything that was kind of covered today. Okay. Well, thank you so much, Larry.
No problem. Everybody have a good day, a good weekend. Stay out of that rain.
You too.
See you later.
Okay. Bye. Okay, so we'll go ahead and end this meeting today. Like I said, if anybody has any questions, just contact HR. And we'll be sending out the link for the recorded benefits meeting today, as well as information on any deadlines for getting information back to us. So yeah, any questions moving forward, just contact HR or stop in and see us. Okay, thank you so much, everybody.